Alright, greetings to everyone and welcome to today's discussion on fetal circulation. Yes, so for us to understand this topic, it is very important, it is very vital that we understand adult circulation. Yes, so the heart is divided in two parts. We have the right part and we also have the left part. Yes. So the right part consists of deoxygenated blood. The left part has oxygenated blood. So deoxygenated blood from all parts of the body is returned to the heart through the inferior and the superior vena cava. Yes, so this vena cava, it basically empties this blood into the right atrium. From the right atrium, this blood, it will pass through the tricuspid valves into the right ventricle. Then, this deoxygenated blood, it will be pumped through the pulmonary artery to the lungs for oxygenation. Yes. Once oxygenation has taken place, this blood, it will then be taken back to the heart. Yes. Through a vessel known as what? The pulmonary vein. Yes. So this pulmonary vein, it basically empties this oxygenated blood into the left atrium. From the left atrium, this blood, it will be passed to the left ventricle through the bicuspid valves. Yes, then finally this blood, it will be pushed, or rather it will be pumped through the aorta to all body parts. That is on adult circulation. Talking about fetal circulation, in fetal circulation we have some additional structures. We have 5 additional structures. What are those? We have the umbilical vein, we have the ductus venosus, we have the foramen ovale, we have the ductus arteriosus, and we also have the hypogastric arteries. Yes, so these are the 5 additional structures in fetal circulation. Yes, so the umbilical vein, this carries oxygenated blood from the placenta to the undersurface of the liver. Then in the liver, we have a vessel that carries this blood into the inferior vena cava. So that vessel, we call it what? The hepatic vein. Yes. Then from there, we also have the ductus venosus. So the ductus venosus, basically this is just a shunt that allows oxygenated blood in the umbilical vein to bypass the liver. Yes. So the ductus venosus, it bypasses the liver directly into the inferior vena cava. Yes. From the inferior vena cava, this blood, it will then be taken to the left, rather to the right atrium through this same blood vessel. Of course, this is oxygenated blood. Yes. So blood from the inferior vena cava, it will be taken to the right atrium through the inferior vena cava. Yes. Then, between the right and the left ventricles, we have an opening. So that opening, we call it the foramen ovale. Yes. So this foramen ovale, it allows blood to pass from the right atrium into the left atrium. Yes. So blood from the right atrium, it will pass through this foramen ovale into the left atrium. Yes. Then from the left atrium, blood, it will be taken to the left ventricle through the mitral valves. Yes. Then finally, this blood, it will be pumped into the aorta, then finally to the and other upper extremity organs. Yes. Then we also have the ductus arteriosus. So the ductus arteriosus, basically this is just a shunt vessel that connects the fetal pulmonary artery to the aorta. Yes. So meaning that blood, of course that is oxygenated blood, from the pulmonary artery, it will pass through the ductus arteriosus into the aorta. So it is this blood that supplies the lower extremities. Yes. After this blood has been used up by the body, the hypogastric arteries, they will then take this blood back to the placenta. Yes. Of course, we have two hypogastric arteries. Yes. So this is how blood circulates during intrauterine life.